So let's continue about our discussion. The topic is hernia and the treatments. In what age can a hernia occur? From day one of the birth till the last day of the life, anybody can develop hernia any point of time. So from the newborn to the very old. It is 12 times more common in the males as against the women. This is about groin hernias. Obesity, previous abdominal surgery, chronic cough, straining during the bowel movements or while urinating, straining of the body while lifting the heavy objects, even persistent sneezing can lead to hernia formation. Whatever may be the reason, the treatment is defined. The mechanical defect, which needs a mechanical repair. So let's see here how the defects can be closed, particularly two major types: anatomical repair, where you are able to see in this first slide that this is the muscle, this is the defect, this is the intestine coming out. We want to just push the intestine back to the cavity, and the defect in the wall is sutured. Hernias which are smaller than 2 centimeters of size can be done with anatomical repair, and they may not need any support artificially to prevent the recurrence of hernia. But there are hernias which are more than 2 centimeters of the defect, or the hernias where the defect is maybe less than that at times also, but the muscles around are weak. So they are not strong and holding, but they are weak. And this forms the potential defect for the future occurrence of the hernia. That is the place where we have to go ahead with a mesh repair, that is an artificial device used to close the defect and strengthen the wall. When we are doing the mesh repair, there are three types where we can really position the mesh. In this graphic, you can see there is an onlay kind of mesh, means this is the defect and we are placing above the mesh. The second type is inlay, where we are bridging the gap. And the third type, which is sublay, which comes from inside. So in layman's world, if I need to tell you, I'll tell you there is a tire which has got a puncture, can be sealed from outside, can be just bridged, or can be sealed from inside. With even common sense, we understand that the inside repair will be the best repair because it tends to help you sustain the pressure which is generated from inside. Now let's try to understand many more details about how to choose the procedure and how to really ensure that it is the adequate repair. Let us try to see here why we call that surgery is the only answer. This is the abdominal wall, these are the muscles, and this is the cavity. Now, the muscles of the wall is showing a defect. From within the defect is coming out the content of the cavity. Now, this content of the cavity will be sent back to the original cavity during the operation, and the defect will be sealed. This is the mechanical kind of problem, and this needs mechanical repair, as we discussed previously also. This operation can be done via three techniques. One is open traditional operation, wherein we make a cut, move within the cavity from the skin to the inside, return the contents to the cavity, and place the mesh so that the cavity becomes closed. There is another type of operation technique which is laparoscopic, which doesn't make any big incisions, but we go in with a keyhole type of surgery. Here you are able to see that. Again, the returning of the intestinal loops to the cavity is done, and from within now we tend to place the mesh. There is a recent advancement in terms of the mesh placement which gives you the dual impact. These are called as the 3D meshes, where this is the hole. We are going to place one layer above the hole. There will be a connector and one layer is beneath the hole. So this is going to ensure a dual protection, and this is one of the very popular operations which can help the patients give a big protection against reoccurrence of hernia. Why we need to actually take care while performing the operations? This is to prevent any reoccurrence. Let's try to see why reoccurrence can happen and how to avoid it. Hernia repair, even if done with the best possible techniques, materials, and in the best possible expert hands, there are some by default reasons why a hernia can reoccur. This can be defined as the tissue related weaknesses. For example, in a malnourished patient or a patient with kidney or liver or heart disease, where the abdominal wall is very thin and the muscles are not very strong. So these are some inherent problems where the hernia can reoccur. But if the muscles are with average strength, and if the hernia is not very huge, we can always prevent the reoccurrence of the hernia. How to do it? 1. Try to avoid all the causes which can lead to rise in the intra-abdominal pressure, like the smoking and the cough, like the obesity. Try to control the diseases of the liver, kidney, heart. Try to avoid any fluid collection inside the abdominal cavity. Long-term use of steroids will make your muscles weak, and that is not a good idea for the hernia. It can always invite infections, and in any which ways, if hernia operation gets infected, the recurrence is the outcome. Avoiding heavy muscular activity after the operation within a month's time is also not a good idea, and it can invite recurrence. So these are some avoidable and tissue related factors when we talk about the recurrence of hernia. But there are few factors which are technique related. For example, if this is the weakness and if these are the muscles which are thinned out, so this is the defect and these are the weak muscles. If I cover only the defect and if I do not cover these muscles, then typically this will be the wrong technique which is giving rise to hernia development or the recurrence. The second part is adequate coverage of the defect. So any defect is not the only defect, but around that almost 3 to 5 centimeters tissue is weak and unable to sustain any kind of pressures. So that is where a larger mesh and adequate coverage of the periphery of the defect is also needed. Tension-free repair is an essential part of the operation because if you try to pull things under tension, you are creating defects on the sides. And this is again one cause leading to recurrence. How to avoid recurrences? We discussed about it. The choice of right materials, right techniques, right patient, optimization of the conditions which are adverse, and the voluntary factors need to be completely explained to the patient. Good, clean techniques and good experts surgically can give you a very good repair which may not give rise to any recurrence of hernia or which will prevent and minimize the recurrence of the hernia. Some of the precautions which need to be taken are obviously avoidance of the predisposing factors. So do not stretch your body at the operated area within 4 to 6 weeks after the surgery. Consult your doctor so that you get the maximum best results. Here I would like to share one of the most complex cases of hernia which I came across till date. You are able to see this lady which is obese, suffering from obesity, and obviously because of the large intra-abdominal pressure, the muscles of the abdominal wall have given way at multiple places, leading to huge hernia. So in this lady, we combined two operations together: treatment for obesity that was done via bariatric surgery and treatment of hernia that was done with the mesh placement. When two major factors coexist, we may combine the treatments in the same sitting or we may defer them one after the other. But remember, in the patients of obesity, if you treat their hernia only and ignore obesity, it is 100% sure that they will come back to you with the hernia. It was a very challenging case of performance of this surgery in this patient, and it took us almost 6 hours to finish off the operation because of obviously the difficulties in handling the patient, even positioning. But fortunately, the procedure was uneventful The patient went home uneventfully, and she is now enjoying her life without obesity and without the hernia. So remember one thing, medical science is there to help anybody and everybody who is suffering from the disease. You have to reach the right expert and try to reach at the right point of time. Hernia being one of the very common diseases, one of the highly ignored health problems, one of the highly treatable and curable, you can say, a surgical disease, still n number of people, because of illiteracy about the disease or the treatments, or because of the fear to undergo operation, tend to stay away from the operations and present themselves at a very critical point of time. I came across one of my friends who was suffering from hernia for years together, where we told him many times to go for surgery, but he said, no, no, we'll take care of it after some time when I'll get my some vacations or leaves. And one fine morning, I received a call when he was doing his trekking at the base camp at Himachal Pradesh. We needed to really airlift him because his hernia was strangulated. We needed to operate on him as an urgent operation. I think this is something which can be avoided. We just need to be aware about the problem and the simplicity of the solution. So, to create awareness about the scientific treatments for the problem of hernia and to build confidence in patients and public about the treatments, we conducted a camp way back in 2005 with the help of my team, and we could enter the Limca Book of World Records by performing 46 hernias in 10 hours in 2005. 44 patients underwent surgery, out of them 2 had 2 hernias. So that is how it went on. Each of the patient went home uneventfully after 24 hours after the surgery, and it could create a lot of confidence in the public's mind. I think the take home message is hernia or any bulge that comes out of your body is not to be neglected. It's a common health problem. It can be treated by simple surgical methods. If untreated, it can lead to complications, can be life-threatening at times, and can be actually completely avoided by the timely surgical action. With advanced latest techniques, this is now a very safe and effective daycare operation. So don't suffer and keep on suffering by hernias. They are treatable. Get rid of them in time. Thank you very much for the patient listening. If any query, please feel free to write to us on the email jayatodkar@gmail.com and get the solutions for any surgical problem. Thank you.